Welcome to Connected by Health. I'm Dr. Krishna Vedala. This is where medicine meets leadership, innovation, and humanity with one goal: to add value and help change healthcare for the better. If you believe health is about more than a diagnosis, you're in the right place. Welcome back to Connected by Health. Today's episode is not about politics. It's about data. It's about lives. It is about public health. In honor of National Gun Violence Awareness Day, today we're talking about firearm violence, not as a partisan talking point, but as a measurable, preventable, population-level health crisis. Because if we're comfortable saying it or not, firearm violence is now one of the leading causes of death in the United States. And when a cause of death becomes this common, this costly, and this preventable, it becomes a public health issue. So, before we go any further, let me begin with some numbers. Not just rhetoric, not just words, but with numbers. According to the CDC, in 2022, over 48,000 people died from firearm-related injuries in the United States. That is the highest number ever recorded. Firearms now account for more deaths annually than motor vehicle crashes. I didn't know that. And to be honest with you, that's frightening to think about that. But here is the statistic that really, I believe, shifts the national conversation. Firearms are now the leading cause of death for children and adolescents in the United States. Not cancer, not congenital disease, not car accidents, but firearms as the leading cause of death for children and adolescents in the United States. Among individuals ages 1 year to 19 years, firearm injuries surpassed motor vehicle accidents in 2020, and they have remained at the top since then. My friends, this is not politics. This is not ideology. This is epidemiology. And the numbers don't lie. But I'm pretty sure some of you are wondering, well, why is this now a public health issue? Or what makes something a public health issue? Public health issues share certain characteristics: high prevalence, measurable mortality, disproportionate burden, system-wide cost, and potential for prevention. And you know what? Firearm violence meets every criteria. So, let's examine it through those lenses, through the criteria we just talked about. You see, when we're looking at the epidemiology of firearm deaths really fall into three main categories: suicide, ranging about 55 to 57%, homicide, ranging about 40 to 43%, and then the third category is unintentional shootings and other causes, ranging at 3% approximately. This is important because when most people think of gun violence, they often think of mass shootings. But statistically speaking, the majority of firearm deaths are suicides. Suicide and firearms constitute roughly 50% of all suicides in the United States, and roughly 50% of them actually involve a firearm. Firearms have a fatality rate of 85 to 90% per attempt, compared to far lower fatality rates for all other methods. What this means is that access matters. Research has consistently shown that states with higher household firearm ownership have significantly higher suicide rates. Again, states with higher household firearm ownership have significantly higher suicide rates, even when they're trying to control for mental health prevalence. The presence of a firearm in a home increases suicide risk by 3 to 5 times. That's 3 to 5 times. This is not speculation. This is replicated across multiple peer-reviewed studies. But let's also look at firearm homicide, because firearm homicides disproportionately impact young men, particularly young black men. Consider this. Black males aged 15 to 24 years experience firearm homicide rates nearly 20 times higher than white males in the same age group. In some urban communities, firearm homicide is the leading cause of death for young adults. This is not evenly distributed. It is geographically and socioeconomically patterned. In public health, that is called clustering. And clustering always implies environmental drivers, not just individual behavior. Let's also take a look at one of the major public health epidemics that we're seeing over the last 2 decades here in the United States, and that is mass shootings, and what the public perception of mass shootings has become. Now, mass shootings may only account for a small percentage of overall firearm deaths, but the problem is that they have outsized psychological and society impact. In recent years, the United States has experienced over 600 mass shooting incidents annually by some databases. That's 600 on an annual basis. That is almost 2 mass shootings per day in what is supposed to be the wealthiest and most powerful country in the world. Unfortunately, school shootings have increased compared to prior decades. Children in schools now routinely participate in active shooter drills. And the psychological tone and toll of this chronic threat exposure includes anxiety, trauma, a lot of trauma, hypervigilance, sleep disruption, and those are just a few to name. This is secondary public health impact, meaning a population-level fear and stress that needs to be mitigated. It is not right for a society to live in fear of the next mass shooting, whether that is at a movie theater or at a sports event or, sadly, at a school. If we are supposed to be the most powerful and most richest country in the world, we should not have to live in fear of sending our children to school. You're probably asking, well, why does this matter? Well, because there's a tremendous cost of firearm violence, and money always speaks greater volume. Unfortunately, that's the society that we live in. But let's take a look at the economic cost of firearm violence. Firearm injuries cost the United States healthcare system billions annually. That's billions. B for boy. Estimates suggest the total economic burden of firearm violence exceeds $500 billion per year when accounting for medical care, lost productivity, criminal justice expenses, and quality of life losses. That's $500 billion. Hospital data shows that firearm-related hospitalizations cost over $1 billion annually in direct medical expenses alone. Many victims require multiple surgeries, ICU stays, rehabilitation, and long-term care. And unfortunately, Medicaid and public insurance programs cover a significant portion of these costs, which means that you and I, as taxpayers, bear much of the financial burden. Prevention, my friends, in public health terms, isn't just about preventing something from occurring in the future. It's also fiscally responsible. Prevention is the fiscally responsible thing to do. Now, let's look at this from an emergency medicine perspective. Emergency physicians describe firearm injuries as the most devastating trauma cases because gunshot wounds are not just about the physical damage, but they also involve a whole consortium of other problems. They bring upon multiple organ damage. They can cause a massive hemorrhage. They can also cause long-term disability. Because children who survive firearm injury violence often face chronic pain, in some cases permanent disability, PTSD, post-traumatic stress disorder, educational disruption. These are just a few things that children face when they are the victims of firearm injuries. Survival, my friends, is not the same as recovery. And survival in the face of mass gun shootings is not an easy task. Public health measures morbidity, not just mortality. So when we're looking at now in terms of gun access, gun storage, and the risk, approximately 30 to 40% of all U.S. households report owning a firearm. Among those households, Frighteningly, millions of firearms are stored unlocked. A significant portion are stored loaded, and research has consistently shown that safe storage, meaning that firearms are locked and unloaded, reduces accidental injury and, more importantly, reduces youth suicide risk. States with child access prevention laws show lower rates of unintentional firearm deaths among children. Access modifies risks. If you want to affect risk, you have to affect access first. And this is very common. It's very common that we have seen this in the opioid epidemic, because just like access to opioid modified overdose risk, just like access to tobacco modifies smoking prevalence and thereby cancer diagnoses, access to firearms modifies and reduces firearm risk. So let's take a step back. Let's look on a global scale on how the United States of America compares to other high-income countries. The United States has firearm homicide rates roughly 25 times higher than its respective peer nations. Think about that, 25 times higher. Firearm suicide rates are significantly higher. Overall, firearm mortality in the United States dwarfs comparable economies. And why is that? Well, simply because the other high-income countries have done a lot of different things, but what's interesting is the other high-income countries still are dealing with some of the stuff that we have to deal with. They're still dealing with mental illness, they're still dealing with violent media, they're still dealing with social stressors. Nothing really is that different in the other high-income countries compared to the United States. But they do have a few things different, and they do not have comparable firearm death rates. And what they do have different is access and regulation patterns that differ from what we have. They limit access and they regulate more. And as a result, your outcomes are also different. It's pretty simple. So what are some evidence-based strategies that we can use to help prevent further firearm-related violence? Well, public health just doesn't diagnose, right? It promotes and proposes an intervention. And some of the evidence-supported measures that we have seen, number one are safe storage laws, like we talked about previously. Safe storage laws are associated often with reduced accidental deaths and reduced youth suicide. Number two, extreme risk protection orders allow temporary firearm removal during acute crises. Studies have shown that reductions in firearm suicides, whenever implemented with these extreme risk protection orders, are very successful. Number three, universal background checks. Surprisingly, this is something that has not really been put into place on a national level. But the reason it's surprising is because the majority of society actually supports it. Universal background checks have high public support. And they're also associated with lower firearm trafficking and lower homicide rates in some studies. Another strategy to look into include community violence intervention programs. These are hospital-based intervention programs that reduce re-injury rates. Of course, we also have to look at mental health crises interventions. While most individuals with mental illness are not violent, crisis intervention models reduce acute risk. And I do want to point this out, because this is something that I've been passionate about for quite a bit in my lifetime. But people with mental health actually are more likely to be victims of firearm violence than the other way. And that's something that we have to emphasize. And I cannot state that enough. So once again, people with mental health are more likely to be victims of firearm violence. But at the end of the day, it all comes to money, right? It all comes to money. For decades, firearm research was underfunded. And in order to refine policy, in order to formulate policy, we need more data. And public health requires data to refine policy. So funding, at least increase in funding, is absolutely necessary. Now, let's talk about the elephant in the room, which is something that we cannot continue to ignore, and that is addressing the political divide. This is not about politics. This is about public health. This is about society safety. This is about creating a society where we don't have to be afraid to go to group gatherings, where we don't have to be afraid of going to an NBA basketball game, or to or even to send our children to school, right? We cannot really live in a society that is always afraid of the next mass shooting. And the hope is when we frame firearm violence as a public health issue, it shifts the conversation. Because public health is not about confiscating guns, right? It's not about taking guns away. It's about risk reduction. We regulate cars with seatbelts and airbags. We regulate medications with prescription requirements. We regulate food safety standards, workplace safety, and this is the same thing. Because risk mitigation or reducing risk is not about eliminating rights, it's about reducing preventable harm, right? We're not taking away anyone's rights by regulating all the things I just talked about, and that is the way for us to look at firearm violence. We have to address this, and we have to address it just like we address all the other issues in our society, whether that is food safety, whether that is driving, whether that is workplace safety. And now we're also going to have to look at firearm violence as a society issue that we have to address. The other thing that we cannot forget about is the connection about youth mental health, because adolescent mental health really intersects with firearm access. Data consistently shows that youth impulsivity peaks during adolescence, and unfortunately, many youth suicides occur during short-lived crises. And access to a highly lethal method dramatically increases fatality and mortality. And so reducing access during moments of crises saves lives. That's not about politics. This is simple behavioral science, simple public health, and simple data. So what is the path forward? Well, let me give you a scenario. Imagine a future where safe storage of firearms is the cultural norm. Crisis intervention is about being proactive. Community violence interruption programs are funded. Firearm research is funded and is robust. Youth mental health care is accessible. Public health transformation is possible. Over the last 50 years, we've reduced motor vehicle deaths. We've reduced smoking-related disease. We've reduced lead poisoning. And if we come together, and if we put the politics aside, if we put common sense into it, we can reduce firearm mortality too. It is not out of our hands. We just have to come together. My friends, firearm violence is not a criminal justice issue. It is not just a political issue. It is more than that. Firearm violence is a mental health issue. It is a pediatric issue. It's an emergency medicine issue. It's an economic issue. It is a public health issue, and now it's basically become an issue regarding the mental health of our entire society. People should not have to live in fear of the next mass shooting. Because when a cause of death, like firearm violence, becomes the leading cause of death for children, we are obligated, ethically and scientifically, to respond. Not with fear, not with anger, but with evidence. Because at the end of the day, health is connected to policy, connected to economics, to safety, to society. And when we invest in prevention, when we invest in life, it's game-changing. Now, I know that firearm violence is a complex public health problem with multiple causes and multiple solutions. It is no longer just a simple political issue. We need to frame it for what it really is, which is it is a public health issue. And that centers on prevention, on evidence, equity, and community leadership. The best results when it comes to reducing firearm violence combine policy, healthcare, community programs, and economic support with careful evaluation and, of course, the commitment to healing. If you'd like to learn more, please do email us at connectedbyhealthpodcast@gmail.com. We would be more than happy to send you some information for more resources, research summaries, and some contact information for local organizations. And if you found this episode useful, please, of course, subscribe, leave a review, share it with someone who cares about reducing harm in their community. And my friends, remember, firearm violence is something that we can solve together. But at the end of the day, it'll only occur if we come together and put aside the politics. Because remember, we all are connected by health. Thank you for listening today. If you found this conversation valuable, share it with someone who could use it. And if you're on Apple, we'd love to hear your favorite takeaway in a review. See you next week.